Hey guys, I am going to cover the two surgeries I've had to date with Crohn's disease. I've had Crohn's since 2013 or so. So as of making this video, 8 years with Crohn's disease. Most of that time I've been on Humira for medication. In 2018, I was well into remission. No signs of symptoms or anything. I do watch my diet and do a couple other lifestyle changes, but other than that, I take my medication and I just rarely get flare-ups. I know the triggers. I've identified the triggers, and I have, work around them and build my life to the point where I really don't activate those triggers. So in 2018, I had a bowel resection, basically where they removed my ileocecal valve, is what they call it. And from what I understand, to look at diagrams and whatnot, it's like the part between the small intestine and large intestine that kind of joins it together. They took that part out. 6 inches or 15 centimeters is basically how much they took out, which isn't too intense. Like, I know people who post online all the time, they have like huge sections of their bowel taken out. I wasn't like that. So basically the reason they did that was that it was kind of like scarred up, and they just took that out. It was a pretty straightforward surgery initially. I went into the surgery. I've always been like super skinny and stuff. The way I sit right now, I'm like 30 to 40 pounds heavier than I was then. So I was, very skinny, because I'm not that thick right now by any means. Went into the surgery. I did it at Mount Sinai in Toronto, downtown Toronto. Came out of the first surgery, and I say first because what happened was, so I come out of the surgery, I'm on the 14th floor, I got a view of the CN Tower, everything is great. Semi-private room. I got someone who seems to be a fine roommate, pretty quiet, and I just get super nauseous, like really, really nauseous. They want you to like get up and move around to get your bowels working, everything post-surgery, as some of you guys may or may not know. So I get up and super weak, very, very weak, and I just start vomiting, and I'm not hungry. It's another thing, and I just vomit. And the nurse that was with me and my mother too, they were like very encouraging, like, come on, just try. And I vomiting. It was just like, it was really, really bad. And then I was still like, my vitals were still hooked up so they could like read my blood counts and stuff. I think I had an artery line, I think is how they were like, they must have been like just drawing blood, doing hourly blood work. But I was in such a like bad condition that I really don't remember a lot of this. I remember like very specific things, the big details, but I definitely don't remember how they were getting the blood. So I think it was my red blood cell count, because that's what anemia is associated with. So it basically went down to like the level of like a newborn infant or something. Like, it was really low. It was below, it was like not even in anemic ranges. It was like way less than that. And it kept dropping and dropping. So they said when I went for my consultation, there was like an 8% chance that I need a blood transfusion. So generally you sign off on that thinking, oh yeah, that's not going to happen to me. Well, it happened to me. So hopefully like you guys don't deal with that. 8% chance that it happened. It happened. I got one transfusion. Nothing really happened. So they did another transfusion. And then they were about halfway through the third transfusion, 2.5 transfusions in. And they basically called in. It was a Saturday night. They called in the doctors. Things escalated pretty quickly, but they were going to put me into surgery because I was basically internally bleeding and they didn't know where it was leaking. I remember my parents were there. My sister wasn't. My parents were there though. My parents were very upset because the doctor was basically like, I'm not shaming the doctor or anything because it's her responsibility to be honest with you, but the odds for me living like were just low. And I'm not really scared of death, so I was like really calm with it. So the doctor's freaking out. Not really, like, doctors don't really freak out, but you can kind of tell when a doctor's not calm. Like, she's like very like on her game, starting to tell staff to listen, and people are making mistakes. She's getting upset, and like things are serious. Things are life and death at this point. So she calls in the surgeons, and they come in, and I just remember like there were so many doctors around me, and so first of all, when I got to the OR, the porter was called. The porter was taking too much time. Like, I mean, it wasn't even too much time. Like, it was like 4 minutes and the porter hadn't showed up yet. And so the doctor on my floor was like, that's it. I'm taking you myself. And I'm like, well, if the doctor, like, usually the doctor of the floor has to stay around because there's like other, like, pretty intense patients on the, like, it was Mount Sinai, at least in Toronto, is like there's lots of kids with cancer and just like lots of serious problems. Like, I wasn't near the top of priority necessarily on the floor. There was some very sick people there. And so when the doctor decided to take me to the OR, I was like, holy, this is real. I was just sedated. I was just low energy. I mean, I didn't really have the energy to freak out or get anxiety or anything about this. Obviously, mother's crying and whatnot, just as you guys would expect, if, it was looking like you were going to die. So kind of like what you would see out of, what's that show? Is it Grey's Anatomy? I'm trying to think. I don't really watch TV, but I think my ex-girlfriend watched it. It was like, I think Grey's Anatomy. And like you see the doctors like freaking out and just doing like all these Hollywood things, but literally the doctor, she had my bed and she like used her foot and kicked these double doors open and pushed me through, and it happened pretty quickly, but it was pretty serious. And the nurse said she was praying for me. She was really nervous because she really liked me and my family. She really didn't want to, I mean, as with any patient, it's the same for any patient, but it gets more extreme when you have a patient that's really good to you and good family, and you kind of bond with them. I'm sure it's hard for the nurses. So the nurse was really, you could tell she was upset. I mean, she was being as professional as possible, but how professional can you be when you're looking at someone who's potentially going to die in the next 2 hours? So I go in, and then I wake up. I remember the last thing I said, I remember right before they sedated me, I just said, please save me. There's like 4, 5, 6, there's a bunch of people around me, just your typical intense OR room, freezing cold, everything as normal for those of you who went into for those of you who've been in a serious surgery. I come out, I don't know how long, the time frames kind of all blend here, I can't really tell you what happened what day. I know my first surgery happened on like a Friday, and then Saturday night is when the next surgery happened. But I can't remember when I woke up and all this stuff went on. But I basically remember waking up after my second surgery. Basically, what happened to that surgery, didn't find anything. I just magically stopped internally bleeding. So they think that they nicked an ulcer or something, but they still really don't know what caused it. It was just kind of magical. I stopped bleeding, and I obviously made it. So things were in my favor then. But I just remember I came out of surgery and I went into, not ICU, but they call it step down. And I'm not sure how many hospitals use that term, but it's like coming out of ICU. It's like the next level of intensive care. So it was pretty intense. It was definitely intense. I mean, I woke up to the sound of family crying because the person next to me died. That's like how serious this was. And literally I woke up and I couldn't sleep. I was just kind of coming out of sedation, midway through the night. Or I don't even know if it was night or morning. My mom says it was morning, but I can't remember anything. I started waking up to family members crying in the next room, and that's really sad. But I didn't really acknowledge because I was on so many drugs, and they give you the pain pump and everything. I just remember hearing people crying, and then realized that later on, I put the dots together. I'm like, damn, that's why they're crying, because their loved one passed away. So there's only 4 of us or 6 of us in this unit. It's really tight, very good care. And I stayed there for a few days. And then I moved down to another room just down the hallway. I had a roommate with a kid who had cancer about my age. He's obviously been there for it was beyond weeks. It was months. He was moved in there. He was playing video games and stuff. It wasn't like me where I planned to be there for just a few days. It ended up being 8 days. But he was it was sad. It's really sad to go in some of these hospitals. So my new nurse, she said that she's never seen anyone in her time working there walk out of step down. Because I walked. I didn't, I had a bed and everything, but I actually got out of bed, took my stuff, and walked out. Most people obviously get out of bed and are pushed because they're unable to come out of step down. You're usually in pretty rough condition. But I was like, no, I'll walk this. I'll get up and I can walk. Because they say how important it is to walk, to get your bowels moving, and you don't want to get blood clots and all these different things. So I'm like, you know what? If it's going to help me, I have no issue having the willpower to get out of bed and walk. And I've had, like I said, I had another surgery I'm going to explain too, and the same thing. If the doctor or nurse wants me to walk, I'll walk. And so, yeah, for that surgery, for the resection surgery, the first surgery I had where they resected the bowel, it was laparoscopic. So it was 4 little, basically where your belt would be, just kind of if you're a teenager who wears your pants kind of low, where that teenager's belt line is. So it's just below the normal belt line, kind of 4 holes they did. And those, I couldn't even, if I looked right now, I don't think I could find the scars. It healed up really nicely. But then when I was internally bleeding, they had to go in for open surgery. So they enter in probably like a 4-inch cut at the belly button, straight down the center. That healed up pretty good if you guys are wondering about scarring. The indent from the scar kind of like helps form like your abs. It makes like a separation. So it actually, like, if you have abs, the inner part in the middle of your abdominal, it kind of like hides the scar, if that makes sense. So it really wasn't that bad at all. That healed up really nicely. And then 2 years later, I forgot to mention, but I wanted to add in that after this first surgery was when I got my iron transfusion. It's a black bag. You sit in a chair for about an hour and a half. And that's when I got my first and only iron transfusion. And after then, I would switch to some special pills. 2 years later, I was here at my apartment. This was just on early February of this year, so this wasn't that long ago. Just got to change my frame of mind now because I just was remembering my last surgery. This surgery was unplanned. So it was a Sunday and I was here. I came back from the gym, normal morning, breakfast, go to town, which is 20-25 minutes away, go to the gym, come home, have my regular lunch, pre-lunch snack, which is a muffin, banana, and egg whites. Typical, I've had this for a year straight at this time. Everything for this day has been normal. And I just get really bad stomach pains, like almost like full blockage. Like when you had a blockage and you know what a blockage feels like, you know how intense it is. Like it is pretty, like I just kind of imagine that it would be similar to like giving birth. Like it's just an intense pain. And so I come out of my office, I lay on this couch right here I'm sitting on, and for about an hour I'm just trying to get pain to stop. I get a cold pack out. I do then my aunt who's a nurse says do heat instead of cold, and I do try that. Lay on my bed instead. I'm like, maybe be more comfortable, maybe I can just fall asleep. Sometimes I think, because I just figure like if I could fall asleep, maybe I could just wake up 2 or 3 hours later and things would kind of like be cleared up. But that's not what happened. So noon, like I said, I was eating. By 1 o'clock, pain was starting, and pain was more than starting. It was intense, and I was on this couch. And then by 5 o'clock, I was in my room, and I'm like, that's it. I got to do something. I got to call someone. I got to do something. So I text my aunt, who's an RN. Then I call my mother. My mother gets pretty worried because she knows, like, I'm not really one to complain about pains. Like, I just kind of have pains, and I just don't talk about them. I'm not one to dwell on my pain or tell everyone about my discomfort or how awful my life is. I'm just not like that. Like if I call my mom and say I'm in pain, she's like she's frightened. So when my sister found out that I was in pain, my sister started crying because she thought I was dying. That's how serious they know. Like when they say, when Josh says he's in pain, he's in intense pain. So my mom called my sister, like I said, because my sister was local. Well, she was 40 minutes away. So the option was either I take an ambulance to the hospital or my sister picks me up, because there's no way I'm going to risk driving because the pain's just way too intense. And so my mother calms down my sister. My sister comes with grandparents because she was just afraid to come pick me up because she didn't know what was going to happen. It was very like freaky. I wasn't that nervous. Honestly, they were a lot more nervous than I was. I just knew I was in intense pain. That's it. And I needed to go get something looked at. So I decided to go to the hospital that night. They picked me up by the hospital. By the time I got to the hospital, it was probably 7 p.m. or something. Wasn't too busy. Thankfully, I got the last hospital bed in ER. In Canada, I don't know if you guys, like in the US, I've been to the ER with some friends, taking them to the ER, and like the ER is never usually a big wait in the US healthcare system, but in Canada, ER, I guess because it's free healthcare, it's just really slow because everyone goes to the ER. They have like anything wrong with them, they go to the ER. And so it's easy to get, like, you can spend 5-6 hours in the waiting room. It's like, I'm not even exaggerating. I've done it many times. So I get in within like an hour. I'm pretty happy. I just assume it's just going to be, and the pain's kind of going down a little bit because I haven't ate anything lately, but it's still there and it comes and goes. So I talked to the doctor. They take me off food and water, like no liquids, no nothing. So this was the start of it. I'm like, no, come on. Because as someone trying to gain weight, I'm constantly eating. Like that's what I do because I work so hard to gain weight. So I'm constantly eating, and every pound I gain is just like, takes so much effort. So I was really upset when the doctor told me no eating and no drinking. Like, because I'm like, oh man, I have a feeling they're not going to let me eat or drink for a while now. And they said they're going to keep me for the night. I had the option to either stay for the night in ER, or I could go home with my grandparents who lived near the hospital, that more closer than I did, because they weren't going to let me go within so much of a radius that I had to stay within a certain radius of the hospital in case anything happened, according to the ER doctor. And so I said, no, I don't have an issue. I'll just stay here. So I stayed in the ER overnight because there was a worry that if I left the hospital, they'd fill my bed and then I wouldn't be able to get back in. And thankfully I did stay, because the next morning ER was busy. Like, it was like dozens of people and there was no beds available in the hospital. So it was going to be like, I didn't know if I would get in the same day. Like, it was going to be a long, long, long wait. So I got the last bed, stayed in ER for 2 nights, then they moved me somewhere else. Basically ended up over the full stay like 4 or 5 different beds in the hospital because I was there for 9 days. So I checked in on Sunday. By Tuesday, my mom flew back to be with me. Wednesday, my dad flew home. Wednesday night was the surgery. My dad landed just after the surgery. But basically what happened after a bunch of, I think I had a CT scan, I had x-rays every morning. It was at a small hospital, so they didn't have certain tools and whatnot to use on me, certain scans, but they did, I think it was a CT scan. Anyways, it's not really that relevant. I did some other scan, and the doctor concluded that I had a blockage, and so he wanted to wait like another day or two. This was on Monday, a day or two. He's like, let's give it a day or two. It should clear up. By Wednesday, he came in Wednesday afternoon. He said, looks like it's not going to clear naturally, because they were giving me, like, they gave me steroids via intravenous. I was on liquid diet, a couple other things they were giving me, fluids and whatnot. They said normally if it's going to open up, it should open up by now. This was on Wednesday afternoon. It hasn't opened yet. So we're going to need to do surgery, and I'd like to do surgery with you immediately. So he gave me about 2-hour notice, and then I went into surgery. Initially, they were going to try laparoscopically to do it. When I got to the OR room, they decided we're just going to do it open. They're not even going to try laparoscopically. So it was a 2-hour procedure. Basically what happened, and they didn't really know what was going on until they got me open. Like, they just knew that something was wrong, something was blocking. But when they opened me up, they found out I had 2 or 3, I don't know how it's 2 or 3, it's kind of weird, but he said 2 or 3 adhesions, which are bands that form from scar tissue from the internal bleeding that happened in my last surgery, that formed and basically suffocated my bowels. And as soon as he kind of like snipped them, I guess he snipped them, the bowel pinked back up, things went back to normal, sewed me up. It took me a few days to get a bowel movement. Eventually I had to take a suppository to get a bowel movement, but it did come, and then I was able to leave, I think, the next day or so, and that was after 9 days. They gave me 28 staples, and I lost 11 pounds in 9 days. So those are the numbers. But that hospital stay was a lot better than my other one, because I was at a smaller hospital. It wasn't a complicated surgery. It was open bowel surgery, which was it's pretty general. The doctor was very confident in it, and it was like a small town, so it wasn't a big hospital. My grandparents lived nearby. My family was there. My family was pretty relaxed because they had, unlike in Toronto where my family was living out of like hotels and whatnot, we could stay with like family and stuff, and we knew some of the doctors because they also did surgeries on my cousins and whatnot. And it was really nice. The nurses were really good to me. I think a lot of them were like surprised that someone so young was in care there. Like, I was, depending on what floor I was on, but I mean, there was no one within 20 years of me, like of my age, even 30 or 40. Like, it was, most people there were seniors. Like, the kids visiting the patients were like my parents' age. So like, they're basically my grandparents' age, everyone in there. I think a lot of the nurses were just surprised to see such a young face. So sick in a hospital, but everyone was really good to me. But that surgery went really well, and that was my adhesion surgery. So that's my 2 surgeries. Really, it turned into 3 with the internal bleeding one. Like I said, I've had Crohn's for about 8 years, and 6 years in, I had my resection. And then 2 years later, they say there's a good chance of that, though, is the adhesions forming when you have surgery. You can get adhesions from any sort of surgery, I guess, any sort of abdominal surgery, not just resections, but bands can form, and sometimes you can keep them, sometimes they don't like affect you, but sometimes I guess you have to go into another surgery. So my worry is like, does the adhesion surgery, could that cause another adhesion surgery? I hope not, but the recovery went pretty well. I'm going to make another video on the recovery alone, but the doctor told me 6 weeks of no gym. I ended up turning that into 3 weeks, and then he cleared me saying, he says I look ahead of schedule, and basically I recovered in half the time it normally takes. So I'm going to go over like what I did to recover so quickly in another video. So if you're interested in that, just go to my channel and search around. I'm sure you'll find that video in the next couple days. Other than that, thanks for watching. If you want to hear more stories like this, subscribe, and see you guys soon.